Dr. Robinson, thanks for taking time to chat with us. And we want to go into a little bit more detail regarding what you talked about on television. I've had a little lower back pain, no chronic thing. I just wonder, is this one of the more common complaints you get from athletes and patients who come to see you?
There's no question. Most people will experience back pain at some point in time. It is one of the most common reasons why people do come to see their family physician.
I sometimes feel like my back hurts a little bit more if I'm 5 or 10 pounds heavier than I need to be. If you can do it, is that one of the best things, maybe planning down the road, one thing you can do is try to stay in better shape?
There's no question. We know that just walking and upright exercise will strengthen up the muscles around the core and help prevent low back pain.
Are some people more predisposed to a future of some lower back pain just because of the way they're built or the kind of work they've done all their lives?
There's no question. People that have to use their back a lot with bending or twisting will end up having more problems later on in life just from nature's own degeneration of the tissues around there and the degeneration of the disc and a little mild of arthritis. But certainly heavy work and heavy duty work will cause some problems later on.
You talked in the segment that you did for us on television about some non-prescription medications that you can take, some muscle relaxers and things like that. Pain in the back, especially the lower back, has to be very extreme, debilitating, I'm assuming, before you start talking about surgically trying to correct something. You want to try a lot of things before that.
Absolutely. Matter of fact, surgery should be your last option and is usually reserved only in extreme cases where there's some other findings such as loss of bowel bladder function or urinary retention or severe muscle weakness or sensory deficits. But just for pain, usually we can control it with just over-the-counter medications and some sort of form of physical therapy or exercise.
You also mentioned a couple of very serious things. Your suspect of cancer is one of your concerns, or a loss of bladder control. That makes you concerned about something else going on besides just overuse or over too much work in your back. Those are real concerns.
Absolutely. We call those red flags, and those are signs of an underlying serious condition, either where the spinal cord is getting narrowed for some cause or that there's something invading the spinal cord like a cancer or infection, these sort of things, and those should prompt somebody to see their physician immediately.
Let's end with this. Let's exercise a little more. Let's eat right and try to keep our weight under control. Do you recommend actual exercises for the back? Sit-ups, proper stretching. Do you recommend that? And how would a viewer find out about those kinds of things that they might want to do if they want to be proactive?
Well, one of the best things for your low back is what we call core strengthening. Most people hear about that, and one of the best exercises that comes to mind with that is exercise like Pilates, where you're actually working on your abdominal muscles and your low back muscles. Your hip muscles are very important also, and most people don't work on their hip muscles when they're doing any kind of exercise. And certainly flexibility is always good, so stretching of the hamstrings and the low back also help a lot.
If you've got lower back pain and you're trying to make it feel better and you don't have any success, it's a good idea to see a doctor and get some more guidance. I guess that would be the bottom line recommendation.
Absolutely, just to make sure that there's no other problems or underlying causes that are more serious, and then they can send you on the way and get you on a good exercise program or have you see a physical therapist or these things.
Dr. Robinson, we appreciate your expertise and your time. Thank you for talking to us today.
Absolutely.